Good morning, everyone. Janelle Tennyson here with the Joint Replacement Academy. How are you today? I have had a busy week at the hospital, and now I have a pretty fun weekend planned. I have tomorrow. All of the kids from our church are coming to do our annual swim party. So it's the kids and all of their moms, and then Saturday, many of the people from our construction company are coming to our house for our annual summer party. So lots of prep work to do for all of that, but it's something that I really enjoy. So I'm looking forward to that. So what am I doing here today? I get up really, really early in the morning. I get up probably in the neighborhood of 4:15 most mornings. If I can, I try to sleep longer, but I love early mornings, so I'm always very eager to get up. But the problem is even though I wake up really early, I waste a lot of time just sitting in my recliner drinking my coffee. So I've been a little bit convicted about that lately. So I decided to be a little bit more productive in my mornings and do something that comes relatively easy to me and yet something that I enjoy and is a little bit productive. So I decided to start covering topics that are easy for me to speak about, that I can do off the top of my head. I'm not quite ready for deep research yet at this time of the day. So today I wanted to talk to you about different aspects of nerve damage, usually temporary nerve damage that can happen after a total knee replacement surgery. In your knee, you have some nerves that go across the front of the knee. They're very small, sensory only, meaning they don't innervate muscles. It's only dealing with sensation of the knee. When they make the incision during your surgery, they have to cut right down the middle of those. Some surgeons will make a little bit of a curved cut, some go straight down, but really in almost every situation, those nerves are cut during the incision. So the tissue that's beyond those nerves laterally will experience a period of numbness. This numbness might get better over a couple of months after surgery. Sometimes it doesn't ever get better, but most people will find that the trade-off of that annoying numbness in the skin of their knee is a pretty good trade-off compared to that burning, grinding hip arthritis pain or knee arthritis pain that drove you to have the surgery. Another type of nerve damage that can happen is a little bit more scary for people. I've seen posts where individuals had this particular situation happen and it scared the daylights out of them because they thought that they were going to be permanently this way. So what is it? You have your sciatic nerve, which runs down the back of your leg. It kind of wraps around on the outside, it wraps around the knee and forms different branches. One of the branches of that sciatic nerve is responsible for pulling your foot up. So when you are pushing the gas, that's one nerve which is very well protected. That one is hardly ever damaged. But the other nerve that pulls your foot up runs right along something called the fibular head on the outside of your knee, which is a hard bony prominence, and that's a little bit closer to the skin. It's a lot easier to damage. So you can get damage to this peroneal nerve by traction, and I'm holding my camera so I can't do with both my hands. So in surgery, when they pull the tissue apart to do the surgery, you can get a traction injury on that nerve. This isn't very common, but if there's bleeding on the outside within the knee, it can put excessive pressure on that peroneal nerve, which can make it cranky and not work very well. And you can also, this is more common, and I've seen this quite a few times, where a surgeon may use an ACE wrap after surgery to control that initial post-operative swelling, and that can be too tight around the knee, and that can impinge that nerve or be too tight and cause some damage to it. Again, the condition with the peroneal nerve being irritated or damaged is called foot drop. It can happen. It's usually temporary. It usually, once the cause of that irritation is gone, it usually does come back. Sometimes you have to wear a foot orthotic for a while to help keep that foot in a kind of a flex position, and that's to avoid falls. You don't want to be, that foot can, as it doesn't move correctly, it can kind of catch on rugs and things. You shouldn't really have throw rugs laying around, but anyway, that can happen. So that's a little bit about nerve damage today. So I will see you in a couple days. Hope you guys have a great weekend, and take care.